Welcome back to the Now Morning Show. My name is Kimberly D'Souza. So happy to be with you here this morning. Now, today is World Kidney Day, which is a global campaign aimed at raising awareness of the importance of our kidneys. World Kidney Day comes back every year, and all across the globe, many hundred events take place, from public screenings, all with the aim to create awareness. And so joining us this morning to raise awareness with our population locally is Dr. Shaun Lynch, a nephrologist at the Eric Williams Medical Sciences Complex. And we also have Dr. Satyendra Persaud, a urologist at the Caribbean Urology Clinic. Doctors, good morning. Thank you so much for joining us on Now.
Hi, good morning, Kimberly.
Good morning.
Good morning.
Now, Dr. Persaud, I'm going to start with you first because, as I mentioned before, we are commemorating World Kidney Day today. And I know that one of the things that we often speak about when we speak about our kidneys are kidney stones. And so, how common are the kidney stones? And I mean, how does somebody develop that in the first place?
So kidney stones are quite common. I mean, globally, it varies from place to place. You're going to see a wide geographic variations. Like, we just finished a study here. Anecdotally, working at the hospital, we see a lot of patients with kidney stones. This is in South Trinidad. And the same thing pertains everywhere else. We just finished a study where we looked at about 1,200 people. And I mean, it was self-reported, so there are limitations to the study. But it may be as high as 16% locally. That means about roughly 1 in 6 people may have kidney stones. And your risk of developing it in your lifetime may be in Trinidad, specific Trinidad, maybe as high as 1 in 3. And it varies.
Develop it?
1 in 3, but the incidence right now, or the prevalence, is probably about 1 in 6, according to our study at least. And it is a multitude of factors. Diet has what to do with it. Obesity, Dr. Lynch will speak to the non-communicable diseases and that have led to kidney diseases like diabetes and high blood pressure and so on. All these things, obesity, all these things contribute to stone formation. Genetics, I mean, it's statistically much more common among Indians than among Afro-Trinidadians. And of course, the climate. Hot climates, people become dehydrated, incidence of kidney stones go up.
And so what are there different types of kidney stones? I mean, is there a variation in size or any particular thing like that?
It varies widely again. I mean, the most common type is one we call calcium oxalate. But there are different types of stones. There's stones that are caused by infection. So it's a vicious cycle. Infections cause stones. Stones lead to more infection. There's one called uric acid stones. And this we can manipulate this particular stone. Is interesting because you don't see it on the x-ray, but it's there, it's causing the patient pain. And the good thing about the uric acid stone is you can change your diet. And you can actually, with time, potentially melt that stone. So there are a number of different stones, and we're doing studies now with the university looking at different types of kidney stones and which one is most common in our population and which demographic and so on.
Yeah. Now, Dr. Lynch, I'm coming to you because I'm not sure if you had any more to share in terms of the causes and particularly, how can we even prevent such kidney diseases?
Hi, morning. So the problem with kidney disease is that by and large, it's asymptomatic in the early stages. So when you have an asymptomatic disease, meaning that patients have no symptoms, what you really need to do to pick it up is to screen for it. In other words, we do a test to look for the disease even though you have no symptoms. So there's international guidelines with regards to who we should screen. And we should certainly screen the group that is highest at risk of developing chronic kidney disease. And that includes people who have diseases such as hypertension, diabetes. If you're over the age of 50, because the older you are, the more likely you are to have chronic kidney disease. If you have a family history of chronic kidney disease. And also if you have certain autoimmune conditions such as like lupus or rheumatoid arthritis and these sort of things. So that's really what we need to do. We need to screen so that we can pick up the disease at an early stage, which will allow us to intervene and hopefully halt the progression of the disease.
Yeah. Now, Dr. Persaud would have mentioned a few causes, but I was also wondering, is there a way to prevent it? Because I know he mentioned things like the weather, sometimes genetics, but is there a way that we can prevent kidney disease or even prevent ourselves from getting those kidney stones?
Well, there's a difference between kidney stones and kidney disease. Kidney stones do not necessarily lead to chronic kidney disease.
Right.
There is an association between the two, and the thinking is that recurrent stones does lead to chronic kidney disease, but it's a bit of a different sort of topic. But in terms of chronic kidney disease, really, the way to prevent them is what we've been preaching for the last 25 years, which is preventing non-communicable diseases, because by far the number one cause of chronic kidney disease worldwide is diabetes, followed closely by hypertension. So if we can actually prevent patients from having those diseases, which is largely lifestyle based, then we would reduce the incidence of chronic kidney disease. So that's probably the best way to prevent it. There's no cure for chronic kidney disease. We do have methods and medications to help slow the progression or to halt the disease, but we can't cure it. And that's why it's very important to pick it up at an early stage, because if you pick it up at an early stage, then you can stop the progression, and therefore it doesn't impact significantly on your lifestyle.
Yeah. Dr. Persaud, I'm coming back to you because as it relates to the kidney stones, is there a way for someone to know if they have them?
Yes, but before we go to that, just to take what Shaun said, to prevent kidney stones specifically, as he said, there's a difference between the two. To prevent kidney stones specifically, diet has a big part in it. In terms of diet, you want to drink more fluids, you want to keep the urine dilute, you want to use less salt, and that helps with chronic kidney disease as well. You want to eat more fresh fruits and vegetables, you want to eat meat in moderation, and please do not stop calcium intake. You don't want to stop calcium intake altogether, or you'll probably end up with more stones. So don't tell people with kidney stones to stop milk and cheese and so on. Let them just continue eating in moderation. But if you know, in terms of symptoms, you're going to get pain with kidney stones. It could eventually lead to kidney damage, but by and large, the most common symptom is pain. You may see some blood in the urine. And when we get these symptoms in patients, the next test is some kind of imaging, depending on what's available. Our preferred investigation is a CAT scan, but you may get an ultrasound or you may get an X-ray as well. And those will pick up. The CAT scan is by far the more sensitive of those investigations. And those will pick up your kidney stones and will tell you how many stones you have, how big they are, where they are in the kidney, because they could be anywhere along the tract from the kidney all the way down to the bladder.
Yeah.
So that's how, if you're looking for confirmation, you get some form of imaging investigation.
Yeah. Now, Dr. Persaud, as it relates to the calcium, you mentioned before that, people who they have kidney disease, they should not be told to prevent with the cheese and the stuff. But if they're lactose intolerant, is there any way to take supplements? Can you take the calcium supplements instead? Or do you still need to get it from the food that you're eating?
No, we don't recommend necessarily with patients with kidney stones. Let's separate kidney disease from kidney stones.
Right.
Kidney stones, we recommend you have calcium from dairy or non-dairy sources. So not necessarily supplements, but there are other things in your diet that you can use to get calcium. It doesn't have to come from dairy if you're lactose intolerant. You need to be careful with the supplements because we don't want you to go the other way and take too much calcium. So if you're lactose intolerant, there are plenty of other foods you can get dairy from. You can get calcium from.
Yeah. Now, Dr. Persaud, we've often heard people with kidney stones often passing it out for particular men. Is that something common? Is it something they should be aware of? I mean, if you do see a kidney stone, it makes sense that you would rush to the doctor to see what's going on. So is that something common that you would probably see, kidney stones if, for example, you're passing urine or something like that?
By and large, the most common symptom is pain. Some people can pass the stones out, but as the stones get larger, there's a less and less chance. A stone over a centimeter, there's a very low incidence of you passing that stone. So the most common presentation is pain in the back, pain in the lower tummy. As it gets closer to the bladder, you feel like you want to pass urine, but nothing comes. That's a very common symptom. You might see some blood in the urine. If you get those symptoms, you need to be investigated. Even if it's not kidney stones, it's probably nothing good. So, if you see blood in your urine and if you have pain like that, you need to see a general practitioner who will then kind of screen you or send you to a urologist.
Yeah.
What Dr. Lynch is talking about is kidney disease with people who got long-term like high blood pressure and diabetes. They damage the kidneys even without kidney stones. And if you're in that category, you're obese, you've got the history of diabetes and high blood pressure, you need to get your kidney function test done, and then if it's elevated, they'll send you to somebody like Dr. Lynch.
Now, before I go back to Dr. Lynch, I just want to stick on the issue a bit, Dr. Persaud, in terms of the kidney stones. What particular treatment are available for people who do have kidney stones?
So it depends on the size of the stones and where the stones are. If the stones are small enough and they're on their way out, we can kind of help them along with medication that will increase your chance of passing stones. Some stones will pass on their own regardless. If the stones are stuck, there are plenty of options locally, both in the private and in the public sector. Fortunately, at San Fernando Hospital, we have keyhole surgery, we have laser surgery, and we have done invasive treatment options, one of which is called shockwave lithotripsy, which breaks the stone up without ever having to make a cut. It's developing locally. More and more places are being able to offer laser surgery in the public sector. And of course, these treatments are available in the private sector as well. But we're fortunate compared to our sister islands.
Yes. Now, Dr. Lynch, quickly, unfortunately, we're out of time, but just quickly, any sort of treatments for people with liver disease?
With liver disease? Well, that's a very open-ended question. The first thing in regards to treatment of any disease is to find out the cause. So it depends on what the cause of the disease is that you will direct your treatment towards it. I mean, in terms of liver disease, is it hepatitis? Is it alcoholic liver disease? Is it autoimmune disease? So that's a very open-ended question. And the first thing to treat any condition is to find out the cause, and then you direct the treatment towards that.
Right, and I'm going to have to pause right there, Dr. Lynch, because we are out of time. Thank you so much for keeping it succinct. And doctors, let me thank you so much for joining us here on the Now Morning Show. As we mentioned, today is World Kidney Day, and thank you so much for sharing your information with us.
Thank you.
Thank you.
And that was Dr. Lynch and also Dr. Persaud just sharing some information as we commemorate World Kidney Day. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.